Is someone having a stroke? Here are 10 warning signs, so you can recognize and respond quickly. A stroke, also known as a cerebrovascular accident, CVA, occurs when the blood supply to part of the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Prompt recognition and treatment of a stroke are crucial for minimizing brain damage and improving the chances of recovery. Knowing the warning signs of a stroke can save lives. This video drills into the 10 most common warning signs of a stroke and emphasizes the importance of immediate medical intervention. Sudden numbness or weakness. One of the most common and recognizable signs of a stroke is sudden numbness or weakness, especially on one side of the body. This can affect the face, arm, or leg and may occur in combination or separately. Facial droop. One side of the face may droop or feel numb. Ask the person to smile. If one side of the face does not move as well as the other, it may be a sign of a stroke. Arm weakness. An arm may feel weak or numb. Ask the person to raise both arms. If one arm drifts downward, it could indicate a stroke. Leg weakness. Difficulty standing or walking due to leg weakness or numbness. A person suddenly experiences weakness in their right arm and leg, making it difficult to hold objects or walk steadily. Their face may also appear uneven with one side drooping. Sudden confusion or trouble speaking. Stroke can affect the brain's language centers, leading to sudden confusion, trouble speaking, or difficulty understanding speech. This condition is known as aphasia. Slurred speech. Speech may become slurred or difficult to understand. Difficulty speaking. The person may have trouble finding the right words or forming sentences. Confusion. There may be a sudden onset of confusion, making it hard to understand what others are saying or to follow simple instructions. A person suddenly begins to slur their words and struggles to articulate sentences. They may seem confused and unable to comprehend what others are saying. Sudden vision problems. Stroke can affect the visual pathways in the brain, leading to sudden vision problems. These issues can occur in one or both eyes and may include partial or complete vision loss. Blurred vision, sudden blurring of vision in one or both eyes. Double vision, seeing two images of a single object, diplopia. Blindness. Sudden loss of vision in one or both eyes. A person suddenly experiences blurred vision in their left eye or sees double. They may describe a curtain-like shadow covering part of their visual field. Sudden severe headache. A sudden and severe headache, often described as the worst headache of one's life, can be a sign of a hemorrhagic stroke where bleeding occurs in the brain. Intense headache. A headache that comes on suddenly and reaches maximum intensity within seconds to minutes. Accompanying symptoms. The headache may be accompanied by nausea, vomiting, dizziness, or altered consciousness. A person suddenly experiences an excruciating headache, unlike anything they've felt before. They may also feel nauseous and disoriented. Sudden dizziness or loss of balance. Stroke can affect the brain's cerebellum, which controls balance and coordination. This can lead to sudden dizziness, loss of balance, or difficulty walking. Vertigo, a sensation of spinning or dizziness. Unsteadiness, trouble standing or walking without falling. Coordination issues, difficulty coordinating movements, such as reaching for objects. A person suddenly feels dizzy and unsteady on their feet. They may stagger while walking or feel like the room is spinning. Sudden trouble swallowing. Stroke can impact the brain areas responsible for swallowing, leading to dysphagia or difficulty swallowing. This can increase the risk of choking and aspiration pneumonia. Difficulty swallowing. Trouble swallowing food, liquids, or saliva. Choking, frequent choking or coughing while eating or drinking. Throat sensation. Feeling that something is stuck in the throat. A person suddenly has trouble swallowing their food and frequently coughs or chokes while eating or drinking. Sudden nausea or vomiting. Sudden onset of nausea or vomiting, especially when accompanied by other stroke symptoms, can be an indicator of a stroke. This is more common in hemorrhagic strokes. Vomiting. Sudden onset of vomiting without an apparent cause. A person suddenly feels extremely nauseous and begins to vomit, particularly if this is accompanied by a severe headache or dizziness. Sudden numbness or tingling. Stroke can cause sudden numbness or a tingling sensation, often described as a pins and needles feeling, particularly on one side of the body. Tingling sensation, a sudden abnormal sensation of tingling in the face, arm, or leg. Numbness, sudden loss of sensation in a part of the body. A person suddenly feels tingling in their left arm and leg, making it difficult to sense touch or temperature changes. Sudden loss of coordination. Stroke can affect the cerebellum, leading to a sudden loss of coordination and difficulty with fine motor skills. Clumsiness. Sudden onset of clumsiness or difficulty performing tasks that require coordination, such as buttoning a shirt. Poor hand-eye coordination, difficulty coordinating hand movements with visual input. A person suddenly struggles to button their shirt or pick up small objects, experiencing unexpected clumsiness and loss of coordination. Sudden fatigue or weakness. Stroke can cause sudden and severe fatigue or weakness, making it difficult to perform everyday activities. Extreme fatigue. Sudden onset of severe tiredness or exhaustion. General weakness. Overall feeling of weakness, particularly on one side of the body. A person suddenly feels overwhelmingly tired and weak, unable to lift their arm or leg or perform simple tasks. Importance of immediate medical attention. Recognizing the warning signs of a stroke and seeking immediate medical attention is crucial. Time is of the essence when dealing with a stroke, as prompt treatment can minimize brain damage and improve the chances of recovery. The acronym FAST is a helpful tool for remembering the key signs and actions to take. F for face, ask the person to smile. Does one side of the face droop? A for arms, ask the person to raise both arms. Does one arm drift downward? S for speech, ask the person to repeat a simple phrase. Is their speech slurred or strange? T for time, if you observe any of these signs, call emergency services immediately. Time is critical. Diagnostic and treatment options. When someone exhibits signs of a stroke, they should be taken to the hospital immediately for evaluation and treatment. Diagnostic tests and treatments include CT scan. A computed tomography scan can quickly detect bleeding in the brain and help differentiate between ischemic and hemorrhagic strokes. MRI. Magnetic resonance imaging provides detailed images of brain tissue and can identify areas affected by a stroke. Blood tests. Blood tests can help determine clotting ability, blood sugar levels, and other factors that may contribute to a stroke. Angiography, a procedure that uses contrast dye and X-rays to visualize blood flow in the arteries and detect blockages. Treatment options. Ischemic stroke treatment. Thrombolytic therapy, administering clot-busting drugs, TPA, to dissolve blood clots and restore blood flow to the brain. Mechanical thrombectomy, a minimally invasive procedure to remove the clot using a catheter. Hemorrhagic stroke treatment. Surgery. Surgical intervention to repair ruptured blood vessels or remove blood from the brain. Medications, drugs to control blood pressure, prevent seizures, and reduce swelling in the brain. Rehabilitation. Physical therapy helps regain strength and mobility. Occupational therapy assists with relearning daily activities. Speech therapy helps improve speech and communication skills. Preventing strokes. While some risk factors for stroke, such as age and family history, cannot be controlled, there are several lifestyle changes and medical interventions that can significantly reduce the risk. Healthy diet. Eating a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can reduce the risk of stroke. Regular exercise. Engaging in regular physical activity can improve cardiovascular health and lower stroke risk. Avoid smoking. Quitting smoking can significantly reduce the risk of stroke. Limit alcohol. Reducing alcohol consumption can help prevent high blood pressure and reduce stroke risk. Blood pressure management. Controlling high blood pressure is crucial for reducing stroke risk. Cholesterol control. Managing cholesterol levels through diet, exercise, and medications can prevent plaque buildup in arteries. Diabetes management. Proper management of diabetes can reduce the risk of stroke. Medications. Taking prescribed medications, such as antiplatelet drugs, aspirin, and anticoagulants, can help prevent blood clots and reduce stroke risk. Recognizing the warning signs of a stroke and seeking immediate medical attention can save lives and prevent severe disability. The 10 signs discussed in this video: sudden numbness or weakness, confusion or trouble speaking, vision problems, severe headache, dizziness or loss of balance, trouble swallowing, nausea or vomiting, numbness or tingling, loss of coordination, and sudden fatigue, are critical indicators that require urgent action. By understanding these signs, promoting awareness, and implementing preventive measures, we can reduce the incidence of stroke and improve outcomes for those affected. Time is critical, and acting fast can make all the difference in the world. If you received value from this video, please like and subscribe to the channel.